Hi, my
Hi.
name's Melissa. I'm going to be your nurse today. How are you?
Doing good, how are you?
Good. So what brings you here today?
I've just had a lot of trouble sleeping and a lot of back pain and neck pain.
Okay. All right. So is there anything, what's your pain level right now?
Probably just like a 3.
Okay. Well, if there's anything I can do to make you more comfortable, let me know. I can also go check the doctor's orders and see what they have for, to kind of get you more comfortable.
Okay.
Alrighty. So I'm going to go grab I'm going to be doing an assessment on you. So I'm going to be checking your scalp, your skin, your eyes, your nose, and your throat. And then I'm also going to be doing a thoracic evaluation assessment and osculating your lungs to listen for lung sounds.
Okay.
Okay, so I'm going to go wash my hands and grab my supplies and I'll be right back, okay?
Okay.
So I leave and then I come back, washed my hands, and so can I get your name and your date of birth?
It's Desiree Salas and it's 2/12/03.
Okay, good. So you ready to get this assessment started?
Mhm.
All right, I'm going to provide some privacy for you and put on my gloves. We would be wearing a mask if we were in the hospital during COVID, but since we're not, we're going to be doing your assessment right now. So the first thing I'm going to have you do is I'm going to be looking at your scalp. So go ahead and bring your head forward slightly. Good. I'm going to check for skin color, any lesions, anything that looks abnormal. I'm going to look in and around the ears. And so that all looks within normal limits. It looks good. So I probably shouldn't have said within normal limits, but I'm going to go ahead and keep on with my assessment. What I'm going to do is be assessing your cranial nerves 3, 4, and 6. And so what I'm going to have you do is look straight ahead.
Okay.
Okay. And then I'm going to have you pick something on the wall, kind of like that clock right there. And then I'm going to have this pen right here in front of you. So go ahead and look at my pen. Good. And focus on the wall. Good. And focus back on my pen. So very good. Pupils are constricting when you're looking at the pen and they're dilating when you're looking further out. Good job. So I'm going to be shining a light in your eye to check for your pupil dilations. Go ahead and just look straight ahead. Good. Very good. It's dilating. Good. Okay, awesome. All right, the next thing I'm going to do is check your cardinal fields. I'm going to have you stare at the tip of this pen and just keep your focus on it without moving your head for me, okay?
Okay.
All right. Good. I'm looking for any abnormalities in her pupil size, the sclera color. Good. Looking for nystagmus. Good job. Good job. All right. Okay, one more test. Go ahead and blink a few times, kind of get those pupils regulated. All right, I'm going to have you stare at the tip of my pen.
Okay.
And I'm going to be moving it towards your nose. And just focus and stay focused right on that. Good. And one more time. Good job. Perfect. Eyes are moving symmetrically. Facial skin integrity is all looking really good. Color of your skin is good. Facial symmetry is good. So I'm going to be assessing your facial nerve and your vagus nerve. So go ahead and open for me and say ah. Good. I'm going to grab my tongue depressor real quick. Good. Open, say ah. Good job. And then go ahead and close and swallow. Good. Stick your tongue out for me and move it from side to side, checking cranial nerve 12. Okay, good job. So the next thing I'm going to do is while I'm talking to her, I'm inspecting her nose for any drainage, looking for any drooling or anything that's going on. Looking at teeth and dentition, making sure that everything is normal as far as no cracked teeth or loose partials or dentures. And now I'm gonna look at your nose. I'm gonna look and make sure that there's no drainage, nothing abnormal for deviations. Good. All right. The next thing I'm gonna have you do is I'm gonna be assessing your trigeminal nerve. And so what I'm gonna do is I'm gonna grab, I wouldn't be telling the patient, but I'm gonna grab a cotton swab, and I'm gonna be checking for the way she can feel the pressure on her forehead. Okay, so go ahead and close your eyes for me. Good. And I'm gonna come across. Do you feel anything?
No.
Okay, good. What about there?
Yeah.
Okay. The next thing I'm gonna do is you'll feel some sensations. Tell me what it feels like.
They're just pokes.
Okay. And now?
They're pokes, but with more pressure.
Okay, good. So I would have had a cotton tip applicator, one with the soft side, and then I would have flipped it over to the other side, and I would have checked to see if it was more intense or less intense. And you were able to do that for me.
Okay.
So now I'm looking at your eyes. I'm looking at ocular motor. I'm looking at the eyelids and the color of the sclera. And
Okay.
so I'm gonna do a little swab test on your eye. So I'm gonna have you look straight ahead. Good, and make sure that she blinks. Good. And looking at the conjunctiva and sclera, all looks really good. Okay. The next thing I'm going to do is have you close your eyes again. Good, and I'm going to be checking for your cranial nerve 3, I believe, your sensation for your breathing. So I'm gonna open this cotton swab, and she doesn't know what it is, but I'm gonna swipe it in front of her and see if she can tell me what it smells like. So I'm gonna see if you can smell this. And what does it smell like?
Like an alcohol of some sort.
Alcohol swab? Good job. Okay, perfect. And so the next thing I'm gonna do is I'm going to check into your ears. I'm gonna grab my ocular scope. I'm gonna look into your ear. Good. Looking on the other side, looking for any discharge, any ear wax or anything like that. And of course, if she had hearing aids, I would have had her remove them. And then I'm going to be assessing your thorax cavity and osculating your lungs, okay? So I'm going to do an anterior, which is an 8-point, and then a posterior, which is 10-point. Okay. All right. All right, so every time I move my stethoscope, I'm going to have you take a deep breath in through your mouth and out through your mouth as well, okay?
Okay.
Good. Tracheal bronchial. Bronchial breath sounds. Intercostal space 5. Good. Okay, and now I'm going to check. Good. So I would have had her shirt off, and then I would have osculated, and then I would have provided privacy right away so that you weren't uncomfortable or exposed for too long.
Okay.
Okay. So are you able to sit up for me?
Yeah.
All right, same thing. I'm going to have you take deep breaths in with each time that I am osculating. So I'm going to start here. Take a deep breath. Good. These are bronchial vesicular breaths. Good. Nice deep breath again. Good. And back down. Sorry, it's my zigzag, but. And back over here. Okay, good job. So she was saying that she has some back pain and neck pain. So I would just assess if there's any tightness, any bulging areas. I would have her back completely, her gown completely down, and I would make sure that there was no moles that were abnormal looking, any sores, anything like that.
Okay.
Okay, so before your assessment of your thorax cavity, I was checking your respiration, making sure that all of your vital signs that we did before were all normal, making sure that you weren't having any, dyspnea, like you were shortness of breath, anything like that before we would have started that.
Okay.
Okay, and so the next thing I need to do is do a visual acuity test. So we would be getting up from, we'll just step right here out of bed because we don't have a Snellen chart, but I'm gonna just have you step right out of bed. Good job. And I would make sure that you're not feeling dizzy or feeling like if you're gonna pass out or anything, you feel like you're stable on your feet?
Yep.
All right, we're gonna just turn and look right over here at this wall.
Okay.
And as the patient is standing, her gown would be slightly open. I would look for any bed sores, any thing that looks abnormal with her buttocks or her lower back and upper back. Okay, and so what I would have her do is I would have her be standing the 20 feet away with both eyes. You're going to read the lowest line possible.
Okay.
After you read the lowest line possible, then you would be covering one eye and reading that lowest line with that eye.
Okay.
Then you would read the lowest line with that eye, and then I can document how our doggy got in here. I would be documenting visual acuity.
Okay.
Okay, and so now we're gonna go back into your room, and we're gonna get you all nice and comfortable. What is the best position for your back as far as, are you okay like that?
Yeah.
Okay, can I get you anything at all?
No, I'm okay.
Okay, what I'm gonna do is I'm gonna lower your bed all the way down to the lowest level.
Okay.
Make sure that the room is free of any clutter.
Okay.
I'm gonna grab all of the bedside table things, your cell phone, tissue, your water is all here.
Okay.
And then I'm going to put your call light in place.
Okay.
So if you have any issues at all or you need anything at all, you press that call light for me.
Okay.
Okay, so if you don't need anything, I will see you here in just a little bit.
All
I'll
right.
be checking up on you in about an hour.
Okay.
Okay?
Thank you.
Alrighty. You're welcome. Thank you.